To Dr. Andrew Meyerson, an A&E doctor who's in London. I know you're from the US originally. Hi, Andrew. Does it need the money, the NHS?
Oh, desperately, desperately. We're talking about so 10 years ago, the NHS was the best-ranked healthcare system on the entire planet. It was the most efficient. It was the least expensive, and we had there was the pride of it should have been the pride of your country, and I think that's just so awesome. I think that's more important than a football championship or a World Cup championship or a Eurovision. You guys had the best healthcare system in the entire planet. I think that's just awesome, and that was 10 years ago after record funding that was invested in the NHS. And then we see what happened in the last 10 years. I don't know if you guys have that graphic that I was sharing earlier from the BBC. We saw a dramatic reduction in funding for the entire across the board in the NHS, for paying for staff, for paying for social care, for paying for hospital buildings. And so now we're suffering the consequences of that. You're talking about a £7 billion hole. It's actually a lot worse than that. We're talking about 10 billion, 20 billion that has been that the NHS desperately needs right now to repair buildings that are about to fall down. If you really want to make a serious effort at reducing the waiting times for everybody, and reducing this massive 7 million people long waiting list, we need investment.
Well, okay.
And if you
hang on. Sorry. Yeah. So we're spooling back away, but you brought in 2012. We had a massive financial crisis in 2008-9. And as a result of that, there was a change of administration, and the last administration left a note saying there's no money, right? And we that's the starting point. And it was true, wasn't it? There wasn't any money. And we've been trying, and then we've got COVID and we've got every other thing happening. And the question, Andrew, is where we're going to get this money from. Because you've got to get it from some other department. Now, you could cancel nuclear missiles. I mean, I don't know what you think, Andrew.
No, this is healthcare is expensive around the world. Every single government, it is a large chunk of national budget. And why is that? Because the health of the population is really important. As Jemma was just saying, for every pound that you put into the NHS, you get 4 back. Okay. If you want an economy that's functional, if you want people to go to work, then you need to invest in their healthcare. This is an important expense. And we've seen what the effects of austerity 1.0 were, and we're about to go into austerity 2.0. And I just think it's unacceptable to put the burden of that, of finding the money for that, on working people right now, especially after we've been through the pandemic. There are people in this country, wealthy people in this country, who can afford an increase in their taxes that will help fund public services so that we can all survive.
That's one way.
And that we can have a functioning NHS.
Okay, we have tax rises.
Business fraud costs 20 billion a year. Useless PPE, that was 9 billion.
Can't get that money back.
1 billion is owed by Amazon alone. You could extend the windfall tax and you could raise 4 billion. You could end non-dom status. You could create 3.2 billion. There are always ways of finding money.
Why don't you go further? Why don't you just find anyone who's worth more than £1 million and take the spare million off them?
But that's
why don't you properly clobber them? You obviously want to.
We're talking about extreme. That's an extreme thing. We can say everybody can give just a little bit more, and we can live in a fair society.
No, but you said the opposite, Andrew. You said no. You didn't say that, Andrew. You said that it's not right that it falls on the shoulders of the poorest workers. So it's not about everyone giving a little bit more. It's about targeting somewhere where we haven't got a tax take.
Well, it's a percentage of your wealth. So if you can take a little bit more of the wealth and still be absolutely fine compared to people who are struggling, and you give another bit off them and they just go under, that is fundamentally unfair.
OK, is that the way to do it, Rick?
No, not at all. So the NHS resort budget in England is currently 152 billion. It's going to increase to 162 billion by 2025. The numbers we're dealing with are absolutely phenomenal. I completely want to fund the NHS correctly, but it's clearly some of the money is being wasted and it's not working correctly. What we actually need to do, solution-based, is come up with a new way of looking at healthcare. This is still keeping the NHS, but looking at the type of thing like an Australian-style model where people are given tax breaks to take out private health insurance Half of Australians have
Andrew,
private medical insurance.
Just before
in the UK, only 13% of people have private medical insurance.
Before I let you go, Andrew,
it will allow, sorry, just very quickly.
Yeah.
It will allow people who most need to use the NHS to have better care.
If more
people have some form of private medical health.
One of the issues here, which is maybe insoluble, Andrew, is that the better the NHS is, the longer people live, the longer they live, the more illnesses they get.